Oh my gosh.
Well, that's when I say, like, it's really hard to crack me. Made the doctor kind of notice it was when I did this.
Oh, yeah.
Which is apparently not normal. Super, super stretchy skin. What you were doing with my fingers, like, I can...
Oh, yeah. What do you need me for?
I can get all the tips of, like... I can crack...
We gotta whisper for the ASMR people. Oh my gosh. That's the finale. Wow. They just keep going. I'm glad you had those saved up for us.
Honestly, the better one is my toes.
Yeah. Can you do those?
My big...
Get those in there. Yay! We are here with Riley Jean, and she has some EDS, which is Ehlers Danlos syndrome, which means that it's like a ligament laxity disorder, so she's very flexible. So that sometimes makes it a little bit hard to adjust. Like a lot of my patients that we work with, it is very loud adjustments. We do have to be a little bit careful. We don't want to go into crazy ranges of motion, so we're very gentle with them. And there's a few different tests.
Hyperextension. I can, like...
Stealing them from me.
Really? Yeah, like, without even trying.
Do you have the finger
if I do that, they'll all crack.
That's okay.
But like I said, with my toes, like...
Do you want to start us off with the finger and toe cracks?
There's no cracks when I do this.
Oh my gosh.
Well, that's when I say, like, it's really hard to crack me.
Yeah.
Like, because they're bent. Even the big toe.
Yeah.
It
so
doesn't.
When we do adjustments, we're basically trying to get the joint to their end ranges, and we just push a little past it. So it's not super necessary to get adjusted for EDS. The patients that I do have, they'll get relief from it, but it's a lot of like physical therapy and like movement to stabilize the joints.
Yeah.
But yeah, we'll be careful if something's too far. I'm not gonna push it.
Okay.
We'll see what happens. So you said you've been adjusted one time, but nothing really happened.
Yeah.
Okay,
no,
cool.
it was nothing major.
So we'll be careful with it. Are there any issues that or pain that we want to focus on today?
I can't personally crack my own back.
Yeah.
Or like I can crack my own neck just fine, but like I can crack my toes just fine, my fingers, but I can't really crack my own back.
Cool. Yeah, that's what I'm here for.
So yeah.
All right. Well, let's go ahead and we'll start with the neck, and then let's start with the lower back, and we'll kind of work our way up from there. I'll be able to kind of gauge some flexibility. Can I see your range of motion real quick? So if you look all the way over your right shoulder, as far as you can go. Yep. Perfect. And then all the way to the left. Good. And then all the way up towards the sky. Does that pinch at all? Feels pretty good?
Yeah, that's pretty good.
Okay. And then if you tuck your chin down towards your chest, that feels pretty good. Mm-hmm. So no issues with any of that. Cool. Let's go ahead and go onto your stomach. And if you'd like, I'll have you kind of face that way with your head, so you can bring it to the side. So it makes testing really difficult when we're kind of looking at our range of motion, because there's really no restrictions like this.
Yeah.
I can't even tell where
the
range stops.
No, like you going with that, honestly.
So we'll kind of go based off of feel. Definitely have some tightness through the right side here. Yeah. All right. When did you know about the EDS? Was there something that kind of brought that on?
No, it was kind of just a trick I showed a doctor, and then they did a test.
Okay. Yeah, you're like,
I did the throat trick because I like have a sore throat.
I don't know that I've seen the throat trick as well.
And the doctor was like, what else can you do? And then I started bending my fingers all the way back, and I was like, these are just fun party tricks. And he was like, no, they're not, I promise. I was like, oh, great.
Yeah, so I forget what the scoring is, but there's like, I think 13 or 14 like different tests that they'll do. And if you hit like 8 of whatever the number is, they kind of put you on the scale for EDS.
Yeah.
And there's a lot more that goes into it internally as well, with the eyes and all kind of stuff. But yeah, we do notice that these patients have a lot of pain. Usually when we think of flexible people, we think like, oh, okay, your body feels great.
And it's no, it hurts.
Yeah, so anyways, well, let's get into it. I'm going to just kind of do some generalized adjustments, see how the body's kind of moving. We're going to start with the lower back, so I'm going to have you face me on this side over here. Yeah, so you can put your head right there. And then you're going to lay kind of like you're laying in bed, so pulling that right arm through. come onto your right hip as well. So, yep. And we're gonna bend this leg here, scoot towards me, towards that. So your right hip, if you can put it right here.
But
So like just
this?
bring that hip through. So
like this.
Yeah.
Okay.
Confusing, I know. And then I'm gonna pull this arm through. Good. And then if you can look over your left shoulder right there. That's perfect. All right. So yeah, the back just kind of keeps going.
I know.
So we can lock out the joint without getting that flexibility fully involved. I'm gonna do a little push right here. Might hear some cracks. There we go.
I was gonna say if you go like really hard with it, you might be able to get it.
Yeah, we found the tension. That felt pretty good?
Yeah.
Awesome. Let's go ahead and flip to the other side.
Okay.
So when you saw the chiropractor, did they do adjustments like this with you?
Yes. But that when they didn't work at a certain point, they kind of just gave up.
Okay.
Like certain adjustments, when I wouldn't crack, they would get like frustrated.
Gotcha. I won't give up.
He wasn't a good chiropractor.
It happens sometimes. Okay. Cool. Already cracking one more. Perfect. Yay.
The big one was good.
Good. So you're perfect on your back. I'm going to have you scoot down all the way towards your feet. Good. And then we're going to take both the hands here. We're just going to do some generalized mobility through the thoracic spine. So see if you can get like super low with that angle. Good. All right. So quite a bit of tension right here. I'm going to have you take a big breath in. Good, let that all the way out. Perfect. And one more, tuck your chin down. Good. Perfect. All right. We did it.
Oh my god.
So let's, we'll get into the neck. Actually, if you could scoot all the way down towards your feet, I'm gonna take this headrest out. So keep coming, good. All right, so new things.
My neck is the one that always scares me.
Yeah, and you just watched your boyfriend get adjusted, right? He was pretty blocked up.
Yeah, he's got a lot in his shoulders.
Do you get headaches or anything like that?
Mhm.
Okay. Is that like a constant thing for you?
It's on and off.
Okay. Cool. I'm gonna do a little bit of soft tissue stuff. Are you doing okay with that pressure?
Yeah.
Okay. All right. Cool. So we're just gonna be really relaxed. I'll kind of show you where that joint locks out, and you'll feel it. So try to relax.
I can
that
already feel
muscle.
it ready to crack.
Yeah. So try to relax that muscle there. Oh my gosh.
Yep, that was what I felt.
A little more. One more. Good. All right. Cool. And you said you crack your neck a lot, right?
Oh yeah, my neck is loud.
Does that give you relief when you crack it? Yeah. But just kind of a temporary thing?
Yeah.
So it's a little bit different when, you know, a chiropractor or somebody else comes in with an external force. We're able to actually get that joint that's stuck versus when you're kind of cracking it, we're getting kind of the top and bottom part. So I can't crack my own neck. I wish I could. I've got to go see the other guy in my office. So, all right. So we'll do a little push. Let the head kind of fall there. Good. All right. And then scoot down just a little bit further. I'm going to do a traction adjustment that'll get everything else going.
What is that?
BRB.
You know, somebody told me once one of my legs is longer than the other. That had to do with something.
Yeah, pretty much everybody's legs are like a little bit longer, so we can like trick you into coming into like 1,000 appointments.
Oh, it's a scam.
It's a scam, yeah, for
You're
sure.
a scam artist. Got it.
Yeah, so unfortunately, I feel like with our profession, we do, like if somebody comes in and they do x-rays and they're like, this is wrong and this is wrong and this is wrong. Do you want to get me talking? Everybody has one leg that's shorter than the other. I feel like out of 20 patients that come in a day, there'll be one person that comes in. I'm like, oh, you're perfect. And we can look at that and we can work on it, but it's as soon as you kind of go and start doing the things that you naturally do throughout the day, it kind of goes right back to the way it was. So
yeah.
I wouldn't say it's a huge concern. There are, in some bodies, there will actually be an anatomical leg that's longer than the other. But for the most part, we call it a functional leg length discrepancy, and that is all just muscular stuff. So your body's doing that for a reason, and it's usually not too big of a deal.
Interesting.
Yeah. So I try to promote just, body image positivity. If somebody comes in, they got some scoliosis, as long as it's not a big deal, we're not going to talk about it too much, because everybody's got a little bit. So go ahead and lift the head real quick. Good. I'm going to pull the hair through. Good. And you can relax back again. Okay.
I feel like I've seen this on YouTube. Whatever's about to happen, I've seen this on the internet.
I swear I'll be more gentle than what you see on the internet. So we'll kind of get it to its end range. If that feels okay for you, then we'll do a little pull. If it feels a little bit too much, we will not do that. So, perfect. We can kind of feel that tension there. That feels comfortable.
What was that?
It feels comfortable.
No, it does right now, yeah.
Okay, cool. And when I pull, that feels okay?
Yeah.
Okay, so we're going to do a little pull at that end. There we go.
Oh, that was a good crack.
Yeah.
I liked that one.
Where did you feel that?
Like
lower neck, mid-back?
Yeah.
Perfect. Hey, good. Not too bad.
Good.
Not as scary as it is on the internet?
No.
So I'm going to just run through all the other joints, and then we'll kind of recheck those ranges, see if that feels more open. I know you already popped your elbow.
Yeah, that was kind of... Good luck with that.
I'm just kind of feeling off curiosity. Cool. Yep, we don't need that range there.
My wrists are pretty bad, too. Like, the range of motion I have with them is pretty intense.
Great wrist extension.
Somebody's tried to do a military press on my wrist before, and it just didn't work because it was like it bent too much.
So I'm gonna put a little traction and a pull here. Good.
Cool.
Good. All right. Cool. And then these probably won't work for you because you're too flexible. But let's see. Yeah, nothing.
I was gonna say good luck there.
We'll get the ankles in here, make you a little taller. Oh, you cracked the ankles. Does that still capture it? That's crazy. There we go. Let's skip this knee. I'm going to assume that's the same. Yeah. I can do that on not flexible people. Cool. Good. Good. All right. Good. And then let's go ahead and sit on up, facing neutral. All right, so we're gonna get the shoulders in and probably call it a day. I'm not gonna do too much. I wanna see how you feel with just the adjustments. There we go. And then one more here. Cool. Yeah, that was like crazy range of motion. Awesome.
And I have really stretchy skin. That's another one of the
get that in
the
there.
ones I have is super stretchy skin. What you were doing with my fingers, I can get.
What do you need me for?
I can get all the tips of I can crack.
We gotta whisper for the ASMR people. Oh my gosh, that's the finale. Wow, they just keep going. I'm glad you had those saved up for us.
Honestly, the better one is my toes.
Yeah. Can you do this?
My big.
Get those in there. Yay! Cool. I know we didn't go through too much specific stuff.
Yeah.
But it's kind of cool to see, how you feel with an adjustment. If that's something that you find to be helpful, if it lasts a good period of time, it might be worth going in and seeing a good chiropractor. You can do that for you.
For sure.
In office, we have a little bit more things that we do, but for now, we'll just keep it with that.
Cool.
Good stuff.
Thank you. Yeah.
Yay.